Now, you heard of these terms? Learning disability, learning disorders, very common, very loosely used, very wrongly labeled also. Okay, and you also know about occupational therapy, heard about it broadly. Can we just have some ideas? Then we get on to the topic. This is a definition of what exactly is meant by OT. Okay, now here this connotation here is more with respect to adults. So when you talk about occupation and all, you'll think, how is it got to do with children? Okay, so basically here, okay, forget the definition, but what you know about OT, what you know about LD, very briefly, whatever comes to your mind, the vaguest idea that you have. Heard about it, as you all said? Yes? Yeah, what it is, what is it? Okay, so is it a learning disability if the child does not have the acquired academic skills which are required, yeah, which is expected of him vis-a-vis his peers? That is what you're saying. Now, the definition of LD per se is if there is a significant discrepancy between intellectual ability and academic achievement. That is an intrapersonal comparison. It is not vis-a-vis the peers. If there is a child, very simple example, a child with a chronological age of say 5 years, okay, but we do a psychological assessment, we find out what is the IQ, from the IQ we get to know the mental age. For example, IQ 90 to 110 is the average range. So if the child turns out to be an average intelligent child, then his mental age and chronological age would be more or less similar, which means his mental age is also near about 5 years. So then you would check on his academic performance. One, the results of the school, then there are standard psychological psycho-educational tests which would give you reading age, spelling age, maths age with respect to the age as well as with respect to the grade performance. Okay. Then if there is a discrepancy of 2 or more years between ability and achievement, then it is LD, not otherwise. This is a strict diagnostic criteria, because if this was not there, each 9 out of 10 would be LD, which is grossly wrong. Yeah, okay, we'll look at all the misnomers and all that later. First, let us get into the basics. Now, one of you all also said that when the milestones which are expected for a particular age gets delayed, okay, that is one of the many causes. Now, first of all, let us look into, I don't have a soft copy for this, but we'll run through this fast. This is very important. This is from a book called, if in occupational therapy, from the treatment point of view, we use sensory integration. Okay, so there are 5 basic senses. Alright, okay, the 5 basic senses, the neurological systems which you are aware of. Now let us look into at what stage it develops. This is the intrauterine stage, at what age it starts, okay, the peak velocity and complete maturation. Now this knowledge is important to understand, because then we know why to catch them young and how using neuronal plasticity, which you all aware of, change in neuronal connections which happens, okay, because of which whatever connections, the neuronal connections are already there, which causes cross wiring, which is called as, because of which all these, you know, disturbances, confusion in the mind, perceptual problems, etc., as we run through it we understand more, which happens. So if we catch them young, between 3 to 5 years of age, then it is completely reversible. Okay, now let us go through this. Tactile, that is the touch sensation, starts at 7.5 weeks in the IU stage. Birth to 2 years is the peak velocity, complete maturation in 6 years. If you see this, all of you all can see this, yeah, as you see the last column here, you would find that, you know, the first maturation level age wise would be 6 years, around 5 to 6 years. That's the reason before the peak, utilize the period in the peak velocity, which is the first 2 to 3 years. This is a peak velocity. Now why it is said, irrespective of this knowledge, why is it said that it is very important to give adequate and proper stimulation in the first 3 years? Why is it said that? Because if your sensory stimulation is adequate, all these peak velocities are optimized depending upon the environmental stimulation. Yeah, now depending upon that, you would have all these sensors would have optimized. So what are you doing by that? You are minimizing any kind of a further delay or inappropriate complete behavior in terms of milestones. here when we are looking, now let us also correlate the sensory development with the motor development. Okay, is this clear? Now the sensory integration, that is integrating all these 5 senses, happens at 4 levels. Okay, so you all are aware of vestibular sense, movement, joint movement sensation, proprioception also you are aware of, joint sensation, kinesthetic, proprioception, vestibular, you are aware of this. Alright, now the first level of integration is vestibular and proprioceptive sensation together will lead to adequate eye movements, okay, muscle tone, because if the muscle tone is not developed properly, all of these would be affected. So muscle tone, eye movements, balance, posture, gravitational security. You are aware of gravitational security? That is, you know, if you have seen a small child, why is this related to vestibular movement? Is because when a child is put in a swing, okay, generally it is expected that a child, the swinging movement will cause a lot of soothing behavior in the child, and the child would relax or either fall off to sleep, which is expected, because the vestibular sensation is needed for the child. That is a stimulation for the child. But there are some where there is gravitational insecurity, means the child feels very insecure because either his muscle tone, balance, posture is not adequately developed for the age. The child becomes very insecure, gets very scared when there is a sudden change in movement. You pick the baby and put it in the swing, do it very gradually and move it, the child will be okay. If you suddenly put into the swing, it shakes each one of us. There is also a reflex because of which you would get shaken up and then you are okay. But if it's a gravitational insecurity as a problem, the mother would always say that in the childhood, early childhood, that is between, in the first 3 to 4 years, it is very difficult to put the child in any swing, jungle gym, any of the park activities which the child does. Okay, so this is important. This happens at the first level. The tactile sensation, the integration levels would be sucking, eating, mother-infant bond, tactile comfort, which comes in the first 3 years. The second level of integration is vestibular, proprioception and tactile sensations, all 3 put together will lead to body percept. Now what is body percept? Is the soft maps of the entire body on the brain. Okay, the map of the body, the sensory map of the body on the brain, which is called body percept or body schema or body concept. It's all the same, or the body image, it's all the same. So when this is adequate, the child has a good sense of body image, because if he is self-oriented, then the child will know how to orient himself in the space in 3 dimension and subsequently 2 dimension of paper pencil activities. Okay, then coordination, gross body coordination, then moving on to fine motor coordination, which would be writing. So these are all happening in a step-by-step manner. Then there is motor planning. How should I hold a pencil? How should I grasp it? What should be the spatial judgment? How should I hold it? How should I orient myself to the line? What should be the posture of the whole body? How should I write? Eye-hand coordination or visual motor dexterity. Okay, so moving from gross to that fine level. The activity level. Now when I am talking about motor activity level, it would be in terms of whether the child is hyperactive, would be in a pathological sense, or is he overactive, is he normal level of activity, or is he underactive. If the muscle tone is very low in a hypotonic child, he would be very dull, clumsy, just sitting at one place, he would be an underactive child. If the child, on the other hand, either it could be a hypertonic child, okay, the tone in the muscles is very high, this child is very highly prone to gravitational insecurity. Okay, these are certain correlations, but it may not always go the same way. Okay, so when the activity level is like this, then the attention span. It is important that these 3 senses at the second level of integration will lead to adequate attention span and then concentration. Okay, and then emotional stability. Now most of the time we feel that sensory areas have got nothing to do with psychological connotations like emotional stability and all, but as we go through this, we understand